Hi there. How's it going? I wish you're fine and your family too. Today, I'm gonna teach you how to talk about coronavirus in English. So, what is coronavirus? Coronavirus is from a family of viruses called the coronaviruses. There are many types of coronaviruses. They're contagious viruses, and these viruses can cause respiratory infections, and it spreads rapidly. The virus, when it invades human bodies, it targets lungs. Okay? Look at the virus. This is a virus. Look here. These are keys. Okay? If we see all these keys, they give a shape of a crown to the virus. This is why it is called coronavirus. These keys, if the keys on the virus fits the locks that are in the surface of the cell of any person, so the cell opens the door and lets the virus enters in. And this one virus produces million viruses. Okay? So, the name of the disease is COVID-19. The WHO announced in the last of 2019 an official name for the disease causing this current pandemic, which is COVID-19. Okay? The WHO, of course, is an abbreviation of World Health Organization. So what is COVID-19? COVID-19 stands for coronavirus disease. Co means corona. V means virus. And D means disease. I'm sure you know what do we mean by disease. If you don't know what do we mean by disease, it means illness. Okay? And 19, of course, it stands for 2019. Okay? So, let's move to talk a little bit about symptoms. What are the most common symptoms? So the most common symptoms are fever, cough, and sneeze, shortness of breath or difficulty breathing. Here when the lungs don't work very well. Body aches means pains in the whole body. All the parts of the body hurts. Diarrhea is when one goes to the bathroom every minute. Throwing up, vomit. And the worst thing is pneumonia. Pneumonia is lung inflammation, and it is the leading cause of death. Okay? Okay, so please follow me. You should protect yourself and your family from this virus, it refers to coronavirus, by following these steps. And as the proverb said, the prevention is better than cure. So it's better to try to keep this virus far from you. My students asked me yesterday a question. Who are most at risk from this disease? Okay, and now I'm gonna answer her. My dear students, all of us are at risk from this disease. But there are some extremely vulnerable people, like older people, and those who has some illnesses such as heart disease, diabetes, and asthma, they are more vulnerable. So, number one, These are the preventions. Wash your hands frequently. Frequently. It means many times a day, not just once a day or twice or 3 times or many times by soap and running water. Okay? Number 2, avoid touching your eyes, nose, and mouth with unwashed hands. Okay? So cover your mouth and nose. Your mouth and nose, not just your mouth and nose, with a flexed elbow if you want to cough or sneeze. Is it clear? I hope so. Number 4, clean and disinfect frequently touched surfaces in the house. Okay, such as, for example, tables, phones, toilets, etc. Number 5, maintain a distance of at least 1 meter between yourself and others. Okay? We don't care whether they're sick or no, but all other people. Okay? Don't shake hands, don't hug others, don't kiss others in their cheeks, or don't. So you have to maintain a distance between you and the others. Number 6, which is very, very important. I think this is the most important point. Strengthen your immune system. Okay? You know that the immune system is the soldiers that we have in our body that fight diseases, viruses, bacteria, etc. So we have to strengthen it, because as we know, there are many people who have a weak immune system. And of course, there are others, they have strong immune system. How can we strengthen our immune system? Of course, by eating healthy food, practicing sports, sleeping well, okay? And of course, we have to overcome stress. Okay, is it clear? I hope so. Here, I want to help you understand what you're reading and hearing and watching, whether in social media or in news. Okay, so let's get started. Here we have the word outbreak. Do you understand what we mean by outbreak? And I'm sure that you have heard this word before. Outbreak is a sudden increase in the numbers of cases of a contagious disease in a particular place or area. Okay? For example, we say there is an outbreak of this disease. Epidemic. Here, the prefix epi means happen. Epidemic is a widespread disease. It's larger than outbreak. Okay? Pandemic. Here, the prefix pan. It's a global disease. That means that the number of cases continue to rise, okay, around the world. Spread. To extend over a large area. COVID-19 or the coronavirus is spreading from one person to another. Lockdown. When people are not allowed to leave their home or their area, their houses. Quarantine. Hold in isolation to prevent the spread of a disease. Okay? Contagious. Disease that can pass from one person to another. I'm sorry, I missed something here. One person to another. Incubation period. It's the time from a person's first exposure to a disease to the time when symptoms develop. This period of time called incubation period. Isolation is the separation of infected people from healthy people. PCR test is one of the tools doctors use to diagnose COVID-19. Okay? So, when people do this test, there is test negative and test positive. Test negative when you don't have the infection, and test positive is when you have the infection. اللهم عافنا يا رب جميعا إن شاء الله. See you later and good luck. Goodbye.